Thank you and good afternoon. So today we are reporting on 3 periods of time. From Friday to Saturday, we had 1,283 new cases diagnosed in British Columbia. Saturday to Sunday, an additional 1,036 new people were diagnosed with COVID-19, and in the last 24 hours, 970 new cases were diagnosed. For 3,289 new cases over the past weekend, bringing our total number of people who have been diagnosed with COVID-19 in British Columbia to 112,829. Of the new cases, 740 are people who live in the Vancouver Coastal Health Region, 1,957 people live in the Fraser Health Region, 167 in the Vancouver Island Health Region, 299 people live in the Interior Health Region, and 125 people live in the Northern Health Region. We currently have 9,937 active cases all across the province, of whom 368 are in hospital currently, 121 people in ICU or critical care. We have 15,900 people under active public health monitoring and 101,216 who have recovered from their infectious period. Over this past weekend, we have 18 new deaths from COVID-19, people who were in hospitals and primarily around the province, bringing the total number of people who've died from COVID-19 to 1,513. As always, we think of those people who have loved ones who succumbed to COVID-19, and we know how challenging it can be right now, particularly. And our condolences and our thoughts go to the families and communities and the care providers who have lost loved ones. We have 2 new outbreaks to report at the Dufferin Care Centre and at Sunset Manor. That brings us to 6 active outbreaks, 3 in long-term care, 2 in assisted living, and 1 in independent living, and 7 in acute care facilities. We do not, at the moment, have updates on the percentage of cases that are variants of concern and the details today due to a data issue. However, we are at approximately 50% of cases across the province who now have one of the variants of concern, primarily the B117, and the additional data will be presented on the BC CDC dashboard later. And to date, we've delivered over 1,112,101 doses of all 3 COVID-19 vaccines across British Columbia. Of those, 87,744 are second doses. And as of today, we know that people 65 and older, Indigenous peoples 18 and over, and people who have received their clinically extremely vulnerable letter can book appointments. Additionally, people age 55 to 65 are eligible, people 55 and over are eligible to get vaccinated with the AstraZeneca vaccine through pharmacies around the province. I'd like to reiterate that while the AstraZeneca vaccine is on pause for people under the age of 55, it is a safe and effective vaccine that's been used in millions of people around the world. And if you are older than 55, I strongly encourage you to get vaccinated as soon as possible. The safety signal that we've been following around the world has been investigated thoroughly, and we are waiting for Health Canada to review that data from the European Medicines Agency and from the UK that came to light last week, and to give us more guidance on the use of this important vaccine here in British Columbia and in Canada. As well, now people 40 years of age and older can register on our Get Vaccinated platform to get onto the registration system, and then you will be contacted when it's your turn to book your appointments as they become available in your community. I also want to talk a little bit about the Parallel Worker Program that we had initially started primarily with the AstraZeneca vaccine. We've continued to focus using that program on transmission hotspots, so high-risk workplaces in the highest spread locations in our province. And that does continue, and we have ramped up that in the last week. So this includes first responders, fire and police services in particular. We know that most of our paramedics have been immunized through our program for healthcare workers. But also it includes school staff and childcare staff in hotspots. Right now, we know that the greatest transmission and the highest risk are in communities in Fraser Health, and that is where we've been targeting these programs in the last few days. We will also continue to focus on other hotspots around the province using vaccines to help put the brakes on transmission where we're seeing it happen worst. And that includes places like Prince Rupert and Terrace, and recently Whistler, where we've had ongoing transmission despite our ongoing efforts at outbreak management. We will also be targeting specific neighborhoods as we have more information on where vaccine is needed most. But I will say, for those identified within this program, particularly workers, please be patient. We cannot go to everybody at once. Like our age-based program, not everybody will get it at once, but everybody will get it and have their turn. And we're focusing on where those areas of transmission are highest to start over the next few weeks, and it will spread out from there around the province. This is, I don't need to say, our third wave. And knowing this, we need to chart our best path forward to manage this wave in British Columbia. We have recognized from the very beginning that the impacts of shutdowns and the measures that we take in public health don't affect people equally. And that has been an important consideration that we have taken all along in our management of this pandemic here in British Columbia. But the goals have been the same. Our focus has been on doing all we can to keep people from getting sick, and particularly to keep people from being hospitalized or dying from COVID-19. But at the same time, we have put in measures to ensure that our health care system can still be there for everybody who needs health care when they need it in British Columbia, and that can be done safely. But along with these important programs of minimizing the impact of this virus, we also want to minimize societal disruption, because we know that the measures we put after the physical, emotional, and mental health of everybody in British Columbia is something that we take to heart. And for us, that has meant taking only as much restriction as we need to suppress the virus and ensure that our healthcare system is functioning and that people are protected as best we can. And that has meant we've been able to safely keep most businesses open. Indoor settings. To people. We've known that from the very beginning, and there's some settings where this happens more easily, and as we've seen these variants of concern that are more transmissible increase in our province, some of those settings have become more risky. Often we are transmitting the virus to those that we are closest to, our families, our communities, our workplaces. As we face a surge in new cases and hospitalizations, we need to focus on the things that will have the biggest impact to break the chains of transmission and slow the spread. And we in public health across this province are working to do just that with every single case and every single contact that we connect with. But it's up to each of one of us to do our part as well. It is our collective efforts that have made the difference so far, and that will continue to make the difference as we weather this part of our storm. To get there are things that we need to do now, and that includes staying home, staying in your immediate neighborhood as much as possible. So if you live in North Van, you should not be traveling to Langley or to Richmond. If you live in the Lower Mainland, you should not be traveling to the island. If you live in Penticton, you should not be going to Sun Peaks or Oliver or Kelowna right now. We need to only do those types of travel if it's essential and nothing more. But we do need to get outside every day. We know there are things that we can do safely, and mostly that means doing them outside and keeping our distance and our safety measures in place. For our own physical, but emotional and mental health, everybody should go outside every day, whether it's in your backyard or your immediate neighborhood. Take your family, take your pet, but find some time to go outside and stay small and stay within your household, your work, or your school cohort only. Seeing a small number of people from outside your household outside is allowed, but it needs to be done in a small way, and we are discouraging even that right now. Public health teams across the province are also doing all we can to slow the pandemic down, and if you are contacted and told that you must self-isolate for the 14 days of the incubation period, this is not optional. And businesses, if anyone on your team is ill or has been told to self-isolate, then you need to support them to stay home until they are better and no longer contagious to others in your workplace. Tonight, the new expedited workplace closure provincial health officer order will come into effect, and this order, as we talked about last week, is an alternative to shutting down sectors. Public health has been working hard with businesses that have been impacted by this virus, and it's through no fault of one business. It's not about blaming them. It's about supporting businesses when this virus comes into your workplace to make sure that we can stop the transmission and prevent it from spreading to workers. This means public health teams, with the assistance of WorkSafe BC, will continue to expand our ability to close businesses for 10 days when there have been transmissions in that workplace, to help stop those transmissions and make sure the COVID safety plans are in place to protect everybody in those situations. The list of closed businesses will be published on the Health Authority websites and BC CDC so that we all know where we're having these challenges. This is about supporting businesses when COVID makes its way into those workplaces. We want to keep businesses open and keep people working because we know how that important that is, not just for the economy, but for our health, our physical and mental health, and our communities. But if business is causing transmission, we need to take action. Keeping people working with good COVID safety plans and supporting businesses where transmission has happened is the purpose of this order, and we will work together to make sure that can happen. For our frontline healthcare workers, and I've met so many of you, treating patients in critical care particularly, for people who have loved ones who are not yet vaccinated, and friends who have gone to work without pause throughout this pandemic, show them that you care. Show them that you may feel that your individual actions don't make a difference, but I'm here to tell you again and again, they do. We are part of the team here in BC, and we can support our communities as more and more people are protected with vaccines. This is where we need to work as a team, more so than ever. We need to support each other to get immunized. We need to support each other to stay home if we're feeling unwell. We need to support each other to stay together by staying apart when we're out or when we're in contact with people who aren't in our households. So I am asking everybody, let's get together, do our part today, tomorrow, and next week so we can get through this pandemic and we can look towards the summer when we'll have opportunity again. And at this time of the marathon, of this storm that we've been in for so long, it's so easy to get discouraged, to get angry, to get frustrated. And now more than ever, all of us have to remember that we don't always know the story of that person who's doing something that's driving us crazy. We don't always know what's going on in people's lives and how they're holding it together. So now more than ever, we need to continue to be kind, to be calm, and to be safe. Thank you.